As we heard in our earlier report, Gaza is suffering critical shortages of medical supplies, and gauze is considered a vital tool in healing wounds. The irony is that this piece of cloth was invented centuries ago in the very place it's now lacking. Gauze derives its name from Gaza, known for its rich cultural history of weaving and cloth production. It's a thin, transparent fabric used on wounds to prevent infection and help save countless lives every day. Other Palestinian cities such as Ramallah, Hebron and Nablus are also renowned centers for weaving and spinning life-saving fabrics. Gauze was being imported from Gaza into Europe as early as the 13th century, but today the war has left hundreds of thousands of Palestinians with undressed wounds, yearning for the supplies they created. Well, joining us now on Al Jazeera is Dr. Ahmed el-Mokhallalati, who's head of the plastic surgery department at Gaza's largest medical facility, Al-Shifa Hospital. He refused to leave his patients behind when Israel laid siege to the hospital in November. Doctor, thank you so much for being with us on Al Jazeera.
Thank you.
Of course, we want to hear about your experience in Al-Shifa and having to treat people with very little means at the time. But I wanted first, I guess, to hear your sentiment a year on from the start of this genocide. How do you reflect on these early days of the war? You were there with your family at the time. What was it like, not just as a doctor, but on a personal level for you to be there at the start of the war?
I think this genocide has, just breaking all the rules regarding any war in the history. And I think what they have done is just starting with the worst case scenarios. So they bombed the hospitals like Ahli Hospital very early in the war, just telling everyone there is no red lines, everything can be targeted, everything can be attacked. And then the hospitals were targeted from the beginning, and they wanted like the victory of to achieve and reach Shifa Hospital as the main, target for the operation. Mm-hmm. And again, the medical staff, the healthcare workers were targets on their own, and we never felt safe at all. Right. And even that increased the risk, to be targeted, being any of the workers in the hospital. So we reached a level that being in the hospital means you are a target. Mm-hmm. We are really scared to go back to our home just to see our families. And it happened in dozens of stories where people will be bombed immediately once they arrive home back from their work in the hospital.
Yeah, and the Israelis claim that Al-Shifa was a command and control center for Hamas in Gaza. But from your experience working there, was that the case?
It happened now like that. They reached Shifa. Mm-hmm. They have seen everything in Shifa. We never seen something really like solid to say Shifa was really a command center or something. And even Dr. Abu Salmiya, who's the director of the hospital, was interrogated, arrested, and he had really hard time. And they never found an evidence that he was in charge of anything. And they had to release him after being, in the court for 3-4 times, interrogated, just tortured, and finally. So it's a fact now that Shifa had nothing, and we know this from before.
Yeah, and you, Dr. Mokhallalati, was working in Al-Shifa. You were in Gaza already when the war broke out. Yeah. Your family, because you're Irish Palestinian, your family was evacuated in November from Gaza, but you chose to stay. Why?
Just like my decision from the beginning to move. I was in London, having good job there, relaxed life. The kids were in the schools, enjoying, comfortable life there. But then I believe always we are under occupation as Palestinians. We have a message, we have a mission to go and to help the people. I believe the international standard of care I learned there, I have to transfer all of this knowledge and experience to the people in Gaza. They are in bad need of all kinds of reconstructive surgery, burn management, and all this stuff. And it was really good experience, being in Gaza for 6 months before the war, where I had really worked hardly on the burn unit, and we had a lot of partnerships with people in France and Australia, in UK, and they were all keen to help Gaza. So I was trying to raise the standards of the medical care in plastic surgery in Gaza.
But how do you raise those standards that you talk about when you're lacking the basic supplies, like gauze, for example, as we saw earlier? How were you able to help people who came to you for help at Al-Shifa Hospital?
So when we reached the wartime, it's totally, another story, another experience. We reached, I'm a plastic surgeon. I had to cover orthopedic surgery in the war, for many, many cases. I have to give general anesthesia myself. Mm-hmm. We have to use one drug medication for general anesthesia instead of 3 or 4. Most of our patients, they have pain untreated. Mm-hmm. They have a lot of wounds untreated. And then, so it was almost always, that we lack something in the care. And we many times use the tissue paper to cover the wounds. It's not like something we're talking about. So we didn't have any of the antiseptic solutions. We used sugar. I remember the first time I heard about sugar was like from ICRC documentary something. And then I just was checking online how we can use sugar to treat the wounds. And then we used sugar, vinegar, soup to clean the wounds. We had nothing. We were running out of all the normal saline, this sterile water. We had to use the tap water, which was very salty. You don't know how clean is that to deal with all of the wounds. We had many patients where we lost the patient because we know the treatment, we know what's supposed to be, but having 20-bed capacity ICU in Shifa and then expanding that to 70-bed capacity, and then that's it. But you will have 300 patients who are in bad need of critical care. So you just watch them and they die. The machines are not enough, the personnel are not enough, the people are not relaxed while providing the care. So it's a lot of really sad story. Feeling your hands are really like tight and you can't do anything to the people.
And as a doctor, that must be very difficult for you. Thank you so much. Dr. Ahmed el-Mokhallalati, an Irish-Palestinian surgeon who was visiting family in Gaza when the war broke out, joining us on the Al Jazeera News Hour. Thank you for sharing your experience with us.
Thank you very much.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.